Welcome to the Openminds Podcast, a space where we reflect on our emotions, our minds, and the way our experiences shape us and who we are today. This podcast is brought to you by mental health professionals who are dedicated to breaking through mental health challenges, looking at relationships, and also looking at developing our own personal growth through meaningful conversations and expert guidance. My name is Sakshi Kaur, your host for this podcast series, as well as a clinical therapist. And together we will navigate through the complexities of the human experience through perspective, knowledge, and understanding. Let's begin. Today we're going to be speaking a little bit about the fear of death, the anxiety that we have around death. And I'm just going to get straight into it. The fact that we haven't experienced death, why do we have such fear around it?
Yeah. Well, it's a very complex question, and of course it opens it opens a psychological inquiry, of course, that we've been trying to develop and understand a lot.
Yeah.
But basically, fear is an emotional experience that arises when we are in danger, when our life is in danger or at risk, right? So basically, that is the opposite of what our brain wants.
Is wired to.
Exactly.
Yeah.
So it's very natural to be afraid of dying. It's very natural to have this motive to survive all the time. So this fear of death, I think, comes very wired in our brain. So our brain is always trying to avoid dying.
That.
Okay. Exactly.
And I guess if you had to, describe to our viewers what death anxiety is, how would you define it?
I think it would be the stress that arises from our own mortality, that like this idea of life is gonna end at some point.
It's a scary thought, isn't it, right?
Exactly.
Even thinking of it now and talking about it, I'm a bit like, I can feel my anxiety rising.
Yeah, and I think we should kind of appreciate this fear because it's what brought us here, right, as humans.
Absolutely.
So we are all the time afraid of dying, even if right now it's not as easy to die, let's say, if we compare it to like millions of years ago, but of course we still have a lot of reasons to be afraid of dying all the time. So anxiety of death is basically like this constant fear of dying, the distress that comes from the idea of life ending at some point.
Okay, so you're saying it's the constant fear of dying, right? Where does that come from? So like in terms of your client work, what have you noticed? Where does that fear around dying come from?
Yeah, so I think we are basically afraid of dying since we were born, right?
Okay.
So it's
very innate.
Yeah, exactly.
Okay,
so we don't
interesting.
even think about it.
Yeah.
But at the end, when we face like near-death experience or we face something dangerous, naturally we're gonna react to avoid it. So it's very natural, but of course, when we are growing up, we kind of develop the idea of what death is for us, what life is for us. So if we think about it, it can be from the fear of like non-existence, which is like basically imagining a world working without us, or the idea of not being in the world that we know, right?
I feel like I've kind of had that sometimes. So when I think about if I'm not here, what's going to happen?
Exactly,
Is that what you're referring to?
Or like life is going to continue normally and naturally without me, and how would it be, right?
Yeah.
It can also be the fear of suffering and pain. So that's the fear of dying by itself, right? We don't know how it's going to be. So that fear of dying can also be part of it, like the suffering and the pain that we might have when we die, right? And it can also be the fear of someone else dying, someone we love or someone that is important for us.
I think to some degree we all experience that, right? We always have that. I think for me personally anyways, it's not more so about myself. I don't think I have anxiety of dying about me personally, but when I think about my family members, my close ones, my loved ones, I feel more anxiety around that, thinking, how would life go on or how even I would cope, to be honest.
Exactly, because at the end, if you lose someone, that's also a threat for your life, for your own life, right?
Yeah.
Because you don't know if you're going to be able to cope with it. You don't know how you're going to handle the situation, if you have the tools to actually survive with that without this person, right?
Yeah.
So that also tells a lot about our capacity to connect with people, to create these meaningful bonds, to actually love people and
absolutely.
you know, like having very important people in our lives. So it's very natural also to have that fear.
I think that's really reassuring to hear that you're saying it's natural, and you know we all experience that. I just want to ask you a little bit about manifestations and intrusive thoughts. How does that play, or does that play a role in feelings of anxiety around death? Does that play a role, would you say?
So death anxiety can manifest in many ways. It can be like these intrusive thoughts that you are constantly thinking about it in different ways, right? Like, how would I die, or what could happen to me? What are all the possibilities that can like put my life in danger? What if someone else die? What if my mom, my dad, my sister, my friend, my boyfriend? You know, like, what if someone dies? So it can be like a constant intrusive thought about what could happen, and this is basically anxiety. What could happen? What if this happens then?
More so those hypothetical worries, right? The what ifs.
Exactly. It can also be like avoidance behaviors. So when we start trying to control all the situation to kind of decrease the distress that comes from intrusive thoughts. It can also be more like, if we go more to the clinical part, like an OCD related to death, for example, like an obsessive compulsive disorder related to death, or a panic attack maybe. So it can manifest in different ways, clinical or non-clinical, depending on how much it interferes with your daily functioning.
Okay, interesting. I think my next question is more so for, I guess, psychological professionals out there, but you mentioned OCD. So I guess what's the key difference between the fear around death versus like generalized anxiety, OCD, or can it be quite comorbid and show up in those different clinical disorders as well? What would you say?
Yeah, I think it can be comorbid, definitely. But the main difference, I would say, and the way I see it also in my clinical practice, is that death anxiety, as we were saying, is very natural. We all have it. We all might experience it in somehow in our lives. But an OCD, an obsessive compulsive disorder, it's more interfering in your daily functioning. So basically that would be having these obsessive thoughts about the idea of dying or idea of death in general, and then a compulsive behavior around that to avoid that distress. So it's more like an interfering process in your daily functioning.
Okay, and I guess can you give me an example of a compulsive behaviour that someone might engage in if they're experiencing that fear around death? Yeah, what would it be? Or a few examples.
Yeah, so if we take the idea of death, it can be like divided in many topics, right? It can be death related to disease, to an accident, to self-harm, lots of different aspects. Yeah. So, for example, if we think about death related to disease, then an OCD could look like having a lot of obsessive thoughts about disease. So, if I feel this, if I have this symptom, if maybe I'm sick, right? And then compulsive behavior would be checking on the internet, like, what if I feel this? What if I feel that? Going to the doctor many times to avoid
so engaging in those, I guess, reassurance-seeking behaviours, to kind of eliminate everything that you're going through. Okay.
Trying to control the situation.
Yeah. But I guess it's quite hard, isn't it, to be able to control every single element, especially when that anxiety feeds into everything else, right?
Yeah, and that's part of the problem, that we can't really control it, but at the end we're trying to control it. So that's when it becomes problematic.
And I guess the key aim would be to be able to manage it, right? Because like you said, we all experience that fear, but it's about how to manage it a little bit better.
Exactly.
What I want to ask you next is about cultural differences. So the background I come from, so I'm born and raised in the UK, but I come from the background of, Indian, so I'm Indian. Yeah. And within our culture, we don't really talk about death. We kind of, I guess, avoid talking about it. Like, I remember, being younger, growing up, I'll say to Mum, like, how would you feel if I was to die tomorrow? Like, if we would have an argument, and she would just tell me to, like, be quiet. Like, why are you talking about that? Stop saying such silly things. Yeah. How would you say different cultures have an impact of this death of anxiety, the fear around death?
Yeah. That's a very good question, because the idea of how we understand death depends a lot of how we have been explained.
Yeah, that's a big one, isn't it?
Right? Yeah. So it's the same in my culture. I'm from Colombia, and I think, I can't speak from all all the like the cities and cultures in Colombia because it's very diverse. But at least in the environment I grew up, it was the same. Like if you say something about death, it's like don't
talk about it.
Don't talk about it.
It's a forbidden topic, right?
Yeah, it's like if you call it, if you speak about it, right? So it's like this belief of words are powerful. Don't speak about it. Don't talk about it, right? There are other cultures that speak openly about it. So of course, speaking about it doesn't really take away the suffering and the pain around death.
Yeah.
But it kind of like give structure and context to the grief, to the mourning process, right? So if you feel like you are supported, that you have a support system, then it's gonna be kind of maybe more effective, or it's going to be easier for you to go through this experience. So definitely talking about it and being able to understand it a bit better reduces the uncertainty that goes around death, right?
And that's what anxiety is all about, like the uncertainty and the unknown.
So if you're able
knowing.
to actually talk about it, and maybe if you meet someone who is going through a near-death experience, like a disease or something, and you're able to actually talk to that person, that could help or not, but at least you can
be a bit more open about it and not kind of shy away from the topic.
Exactly.
Interesting. Before we continue, let's take a moment to talk about mental well-being. At Openminds Centre, our dedicated team of professionals is here to support you, whether you are navigating stress, anxiety, relationship challenges, or personal growth. With expert psychiatrists, psychologists, and specialised therapists, we provide tailored care for adults, children, and families. From therapy sessions to mental health workshops, we're committed to helping you find balance and clarity. Openminds Centre is your space for healing and transformation. Book an appointment today and take the first step towards a healthier mind. Clear minds, healthy lives. Now back to our conversation. Laura, so obviously being a clinical psychologist, you must be seeing so many patients and clients daily. I want to ask you a little bit about your experience and what you've come across when you've met those who have that fear around death.
Yeah, so sometimes it's very hard to identify, even for them, like to identify that their anxiety, their constant worry comes from that. I would like to give you an example of at one point in my career, I had the opportunity to work in a cardiology unit in a hospital. So my role was to support patients going through surgeries, high-risk surgeries.
Wow, that's intense.
Yeah,
very intense.
Or the recovery of the heart surgery, right? So most of them were around 70, 80 years old.
Okay.
And most of them were told either implicitly or explicitly that they were near to dying in some way, right? So I had the
goosebumps listening to this, honestly.
Yeah, and I really appreciate it because I had this rare privilege of talking with them about what life and death meant. So I started seeing a pattern in these conversations with the patients, and it was that the ones that were more calm and like hoping better, more effective with this death idea were the ones who felt satisfied with their lives, with like this sense of fulfillment. Especially in
so what they've
relationships.
already experienced in their life already,
Exactly.
they've had quite a content, a happy life.
Exactly. And more than a happy life, I would say they were satisfied with their relationships, interpersonal relationships, family, social. And these consequences, of course, made them have a better support system. So most of them, the ones that said like they loved well, they really nurtured their relationships, they were the ones who were coping better. It's like they were kind of ready to end their life. So they were ready not only medically, but also emotionally,
which
they
is
were
important.
supported. Yeah, exactly. And on the other side, the patients that were not really satisfied with their relationships were the ones having not only this anxiety around the medical procedures, but also the anxiety about unresolved issues
Okay.
while they were living like the whole life, right? So
again, what's going to happen when I'm not here? This is not solved. Or I've had an argument, X, Y.
Or maybe regret, like I should have made that call. I should have had that conversation, you know, like regret, guilt.
Yeah.
So I think one way of also working on that emotional experience around death is trying to hear emotions. What are they telling you to do? What are they motivating you to do? Because it's completely normal to have this anxiety telling you, hey, call this person, because you don't know if you're gonna see them again, right? So that anxiety is also pushing us to do this. So I think in the realm of relationships, it's very important to consider the death anxiety as well.
Did you feel like that was the biggest factor, the relationships? Is that what you saw the most in terms of all the patients you saw?
Yeah, 100% relationships. Not even like professional achievements or financial achievements. No, it was more relationships.
That's very interesting, isn't it? But I guess I kind of hear that because constantly we're in touch with humans. You know, we go home to our families or we go into work and we have relationships with our bosses, our colleagues, our employees. So I kind of get that. In terms of tools and coping with this fear of death, what would you, how would you work with a client, and what sort of tools or strategies would you give them? I know it's not a very short answer, but if you could kind of, you know, just put it into a few sentences and maybe describe a case, that would be really helpful.
Yeah, of course. So I don't really want to simplify this because
of course
we need, there is a lot, so I don't want to send the message of like there are specific tools that will work for everybody, and that's a very personal process.
Absolutely.
But I would say in general, it would be kind of accepting that we all gonna experience it in some way, so we can't avoid it. So it's not even useful to try to avoid death or not speak about it to avoid it, because we can't. It's completely out of control. One of the only things that we know for sure is that we're gonna die, at least for sure, for now, right? Like we don't know what's going on in the world.
Unless some technology comes in and makes us immortal, right?
Exactly. But right now, one of the things that we have like certainty about is that we're gonna die, and that kinds of, and here comes like the second tool I would say is it's very useful to give meaning to our life. Because imagine if we knew that we're going to live forever, maybe we would postpone even more the things that we're already postponing. We wouldn't be excited about things happening, and we wouldn't feel that rush of doing things, which is also exciting and it's also very meaningful.
Absolutely.
So finding a way to give meaning to life, and like life and death in general, I would say that's one of the good mechanisms. We can do that in many ways, like reading about it, talking about it, but kind of at least pay attention to what death means for us.
Being really aware of it is so important, isn't it?
Exactly. I think how we're going to use it, right, in our lives.
Absolutely. I think even whilst you were talking and you were mentioning, you know, if we had infinite amount of time, we wouldn't be motivated to do certain things. And I'm just kind of thinking about myself. It's so true. Our time here on earth is finite. So it kind of, in a sense, motivates us to get things done, achieve certain goals, achieve certain milestones. So I think that I completely resonate with that, and I think everyone else probably does as well.
Exactly.
I think for me, what I always say, and it's really interesting, is that death is the one thing that's guaranteed in life. So just for me, it comes back to the why. So even though every single one of us knows, you know, death is guaranteed, why are we still so fearful of it? For me, like, I know you've answered this, for me, it just still strikes out really loud as well.
Yeah,
it's 100%. Interesting, isn't it?
Yeah, I think it's kind of recognize it, accept it, and use it. Like, take advantage of it. So I'm afraid of dying, of course, because I like my life, because I like the people I have around, because I'm enjoying life. Yeah. So how can I use that on my behalf as well, right?
Yeah. If you could sum up in a sentence or two what you would say to someone who just said to you, you know, just in a passing conversation, just said to you, I'm scared of death, I'm really, really scared of dying, what would you say? Say that person was me. What would you say to me?
Yeah, I would say, of course, that means that you're enjoying life and that you want to be here and that you are taking care of your life. As well.
And I think it's always putting that positive spin on it, right? I'm so fearful of that death because I'm having such a good time being here, right? And being around people, doing the things I'm doing. So it goes back to that element of fulfillment, like you mentioned.
Exactly. And also, if you're afraid of losing someone, it's like, of course, because you love that someone, or that someone is important to you. So you have the privilege of having that someone in your life. Then of course you're afraid of it. So if you have the capacity of being afraid of them, it's because you have the capacity of caring about them, right?
Yeah, absolutely. Just before we wrap up, and I think this is a question on my mind and on probably everyone else's mind as well. If, you lose someone quite close to you, how, again, I know you can't answer this in a nutshell, but what would be one piece of advice that you'd give? How could someone cope with that?
So I would say first to understand that the grieving process is very, very personal. Yeah. So we can't expect experiencing it like in the same way that someone close to us did, or maybe you have this idea of I should manage it in this way or that way. It's like it's very, very personal. So I would say like kind of treat yourself as you would treat a friend in the same process, like in a very compassionate way. Yeah. Be patient. It's gonna take time. Takes time for your brain to process the new environment without this person. Yeah. So give your brain time, give yourself time, and try to identify what are the things that help you. If it helps talking about it, if it helps finding a support group, if it helps isolating yourself a bit if you need it also, but always try to find the things that help you, because sometimes something that could be very common is that we try to avoid it completely, and I don't want to talk about it, and I want to continue with my life. It's like it's normal that you want to take your time to process this new information. So it's very personal. Don't compare your process to other person's process. Yeah, exactly. And take your time and do everything that helps you.
Yeah, thank you for that. I guess it's just a journey that we all go on. And something you said that I'd like to pick up on was you said, we shouldn't, you used the word should. So you said, we shouldn't think we should need to do this or must need to do this. And for me, even as a therapist or just as a person myself, using those words should and must puts a form of pressure on you. So I completely agree. Just kind of taking that away alleviates that pressure. Exactly.
Yeah. Like there's no a specific correct way of living.
Absolutely.
This transition, right? It's just very, very personal. So if you find yourself in an I should do this or I should be doing that, it's like you shouldn't. Like nobody's expecting nobody's expecting something specific from you. Like even if we have tried to kind of standardize the process of dying or grieving someone, is like it's your personal process. So don't put it in a very
and a rigid.
Exactly.
I mean, this was such a heavy conversation, but I think you gave me, and I hope our viewers, so much insight into this whole topic about the fear around death. Thank you so much for your time, Laura.
Thank you.
It was lovely to have you here.
Yeah, thank you.
If you found this podcast insightful or you enjoyed listening to it, don't forget to like, share and subscribe for further conversations on everything mental health related with our professionals. If you need support, Open Minds is always here for you. See you in the next episode.